Cultural competence and culturally responsive care. My name is RRobinson and I'm an occupational therapist. I am presenting to you today. Throughout this course, you will become knowledgeable about cultural diversity, develop a form of respect of various cultural differences in our patients and your fellow coworkers, effectively communicate with others of various backgrounds to promote a safe environment and workplace. Today's objectives include define culture and cultural competence, explain the importance of cultural competence in our work environment, describe strategies to enhance your ability to effectively work with our patients and your colleagues. Let's test your knowledge about cultural competence. Choose your answer. What is not an effective form of communication? The second question, cultural competence is the ability to respond effectively and appropriately to different cultural contexts. Now let's watch a video of a common cultural interaction all of us may have experienced or will experience. Please click the link to see the video. Just to let you know, the video has been silenced for this course. After viewing the video, what are your thoughts about the patient or the healthcare provider? How do you feel about the way the patient was being treated? What are the ways we can create better patient interactions? And what other ways could you have handled this scenario? Now, I want you to think about being in our patient's shoes for a minute. How would you want to be treated? Most often, thoughts of respect, kindness, understanding, integrity with compassion are all words that come to mind when you think about how you would want to be treated as a patient. Is that all that patient care involves? No, and that's a hard no. We know patient care involves more than managing their illness. It includes their culture and how a patient perceives the interactions that we engage with them is often a perception of their own culture. So what is culture? Culture is shared ideas, beliefs, ways of living that include customs and languages within a particular group. Culture is dynamic and constantly changing. and it involves more than race or ethnicity. Cultural diversity includes those human differences that are noticed and deemed to matter within specific social structures. These differences create power inequalities. All aspects of diversity can impact the outcome and quality of our services. Cultural competence, awareness, and knowledge of self, others, and situations. There's an open communication with positive attitude and a respect for the other person's similarities and differences. Assumptions. Assumptions are those thoughts or impressions perceived to be true. They are distorted reality. And biases. These are the ideas or attitudes which are unconscious and can be positive or negative. Remember, these ideas or attitudes can be unconscious. Now that you are aware of the concepts on culture and cultural diversity, assumptions and biases, now let's watch this video with the sound enabled. Now that you have seen the video, what were your assumptions and biases? Are they true? Do you feel the patient was treated fairly? Did the healthcare provider demonstrate culturally competent behavior and communication? What other ways could this interaction have been handled for better patient interaction? Now let's talk about the patients who are in our care. We typically see individuals who are 65 years and older. Statistics from the U.S. Department of Health and Human Services say that over 70% of these individuals turning 65 will need long-term care. Our patients can be Black, white, Asian, or any other racial or ethnic group. They can have served for our country. They can be male or female, or speak another language, or have another religious preference. We can encounter a homeless person in our care, as well as someone who is gay, lesbian, or transgendered who prefers to dress in a way that identifies with their sexual gender identity. So why does culture matter? We want to reinforce positive traits to our patients and be role models to our healthcare team. We want to prevent patient dissatisfaction and increase their health outcomes. We do not want to be reasons for deterring their illness and healing process while they are here in our care. Most importantly, we do not want to promote stereotyping, bias, or discriminatory treatment of our patients. We want to decrease stigma and ignorance within our environment, as well as show improved communication and understanding of all the cultural differences that are here. We definitely want to be attentive to our patient. In order to do that, we must be aware of their culture. Most importantly, their culture can dictate how they perceive their pain or their illness. And in order to understand the patient, we need to communicate. And that communication can come as expressive and receptive language. We need to look at their gestures on how they communicate. That can give us more information, as well as the context, this environment. We want to be a place of healing for our patients. So how do we provide culturally competent care? By being knowledgeable and showing awareness of others. Have open communication, as well as self-awareness and management of your own personal biases and assumptions. We must stop before engaging in the other behaviors with our patients, which include derogatory language, abusive behaviors, name calling, or even avoidance. The other behaviors can lead to elder abuse. So who protects our patients? The Elder Justice Act is a federal law that protects elderly within long-term care settings. Also, the Centers for Medicare and Medicaid provide ombudsmen who are advocates for elderly within the long-term care setting. And most importantly, you. So what must you do? It is important that you know the behaviors that can lead to elder abuse. So you need to prevent it. It's also important that you recognize the forms of elder abuse. And last, when you see an event of elder abuse, report it to the facility's administrator. Now let's see what you've learned. What is not an effective form of communication? Suspending judgment, determining who is right, listening closely, or discovering what you do not know. If you chose B, determining who is right, you are correct. Cultural competence is the ability to respond effectively and appropriately to cultural contexts. If you chose true, you are also correct. So by now, you should be aware of and value the factors that make each of us different. You should be a more culturally competent individual by being knowledgeable about your own biases and factors of diversity within our environment here. You should have learned effective communication skills to respond to cultural differences and developed respect for those we serve and work alongside. Most importantly, you're here to provide holistic patient-centered care, and that involves attitude. Here are some examples of characteristics of attitude that we should possess. Empathy, curiosity, respect, sensitivity, to name a few, as well as awareness by being knowledgeable about attitudes, values, beliefs, and behaviors of various cultural groups that may stay with us. So in knowing the cultural history and stressors that one may have undergone provides insight into being culturally sensitive and aware to their needs. And looking at this slide here, there's a square and it has a design in it. And that design may not mean anything, but it makes it square. The square that was once just lines and patterns now has a whole new meaning. Each individual square in this image has its own unique pattern, but once put together, it creates a unique design, such as this photo here by Chuck Close called Kara. This completes my presentation today. Do you have any questions? Please feel free to review my references to explore cultural competence and cultural responsive care a little further. Thank you.